So Kylie unfortunately has sustained a mid-radius fracture due to falling off of her horse. She underwent ORIF yesterday, and she's in need of an immobilization orthosis to prohibit any type of forearm rotation. So when constructing the orthosis or thinking about it, we decided to go with the Orfit Natural 1/8 inch. It has great memory, so it's easy to remold. It's not perforated, which makes it a little more durable. Also, thickness makes it a little more durable since we're including multiple joints. It's very easy to stretch this material, so that also makes it a little bit easier to work with, really. So when doing the pattern, we wanted to make sure that it would clear her thenar eminence, so that she could oppose all of her digits. It would clear her distal palmar crease for the same reasons, and also to leave a space for her elbow to be able to flex and extend. But we also wanted to support her elbow, so we have flaps that will cover her medial and lateral epicondyles. So when constructing the orthosis, we made sure Kylie's forearm was in neutral, and we used gravity to kind of do the work. It was easier to start proximally, actually, to support her palmar arches. And then after that started shaping, we moved distally to support her elbow. And when making the pattern, we double checked to make sure that she could still have room for forearm flexion and extension, and also that there was room in the thenar eminence and that it was clearing that distal palmar crease. So the pattern looked great. So we're ready to make our orthosis. Then when making the orthosis, we wanted to also keep in mind her bony prominences to prevent any type of skin breakdown. So we added some padding to the lateral and medial epicondyles, also for the ulnar head and radial styloid. So I'm actually going to have Kylie wear this for us now. And I'm going to have her practice putting it on herself so I can make sure that she can put it on and take it off at home. Great. And we're going to do the same test that we did with the pattern. So can I see you flex and extend your elbow? Great. Can I see you oppose all digits using your thumb? Perfect. And then can I see you make a full fist so that she still has functional grasp? Great. So now when wearing this at home, Kylie, you're going to want to clean it every day, so just use disinfected wipes. Try not to leave it in the car. Any type of heat can actually morph the material, which we would have to remold it then. If at any time you feel discomfort or that it's rubbing against you at any time, to please call me and we will make any adjustments that are needed. You're going to need to wear this full time for the next 6 weeks. The only time you'll take it off is for cleanings. And do you have any other questions?
No.
Okay, great. Just give me a call if you have any pain or discomfort with it.
Okay, thank you very much.
Show you how to make the pattern for the Muenster Orthosis. So go ahead and put your client's hand on a piece of paper towel, and then we're going to be marking just near the elbow right here, and that'll be the end of the Muenster. And then make another mark just proximal to the 5th metacarpal as well as the 2nd metacarpal, and that's going to be associated with her distal palmar crease. And then go ahead from the marks you made, draw a line about 2 to 3 inches apart from her or away from her arm, and then draw a line between those 2 dots, and then Kylie, go ahead and put your elbow right there again, just so I can make sure I give you enough material to wrap around that forearm. Okay, And then between these two marks that I made near Kylie's elbow, I'm just going to go ahead and make a half moon shape. And this is going to allow Kylie to bend her elbow. And then up here, just make a thumb hole. And you want to make it big enough that you can roll it out when the plastic is heated. You want to make it big enough so that her thenar eminence is completely able to oppose all digits as well as make a fist. And then that is the Muenster Orthosis pattern.